Well, hey everybody, I want to say welcome to you to the online abnormal behavior class. My name is Glenn Killian and I am the instructor for this class. Many of you have been with me before in either face-to-face or online classes, and so I say especially to you, welcome back. It's good to see you again, but many of you may be brand new to either my online classes or to any class with me at all, and I want to say a big welcome to you as well too. I'm posting this video here at the start of our class just to kind of make sure that we get off on the right foot. And I want to share a little bit of it, just some basic information out of the class syllabus, talk to you a little bit about just kind of what the class is about, put some important reminders in front of you as we get started to make sure that we get off on a good foot. But as I said a minute ago, my name is Glenn Killian. I'm one of the two full-time instructors in the Human Services program on the Montgomery campus here at Lone Star College. I have been teaching here now for over 20 years full-time. And it's just a great job. And what makes the job great is students like you. I get to work every day and every week with great students who have a heart and a passion for working with others and serving others and helping others. And also, too, I get to talk about what I have always had a passion about, and that is things related to human services and counseling and psychology. I've always been kind of wired that way. And so it's just a great fit for me as far as being able to talk every day and share with students every day about what I am interested in and what I am so passionate about in my own life as well too. So welcome to you. I want to say that I'm glad you're on board for this great class. I always have a special connection to the abnormal behavior class for a couple of reasons. One of the main reasons is why this was one of the very first classes that I taught over 20 years ago when I was teaching here as a part-time adjunct instructor. I have my license as a professional counselor. I was working in children's mental health at the time, and I came to be a guest speaker in one of our classes here many years ago. I was honored to come and speak for a couple of semesters as a guest speaker. And the person who was in charge of our program at that time gave me the opportunity to come up one night and to teach a class. And the second class that I taught, not the first one, but the second class that I taught, she offered me the opportunity to teach this class, the abnormal behavior class. And it kind of fit with what I was doing at the time. I was working in a community mental health clinic, primarily with children and families. And it was what I was doing every day. It's what I was sort of drawn to. And I always think about this class, whenever I start teaching this class for the first time again, I think back to that very first time I ever taught it many years ago. This class has always been kind of special to me for that reason. One of my favorite classes to teach is the abnormal behavior class, this class that you're in with me this semester. So I'm looking forward to it as always. I'm excited as always. I hope you're looking forward to it and planning for a great semester. So here, a couple things before I turn you loose on our first module. First of all, if you've not done this yet, I want you to go find the class syllabus. I want you to navigate back to the table of contents in the classroom, and I want you to go and find the syllabus that I posted for you. It's blue on the front, it looks just like that. There it is. You know, if you've been in any kind of level of college class, whether it's face-to-face, hybrid, or online, that the syllabus is the guide for the class, and that's the case in this class. So you want to make sure, if you have not already done it here in the first week of class, that you go find the syllabus and that you take a look at my contact information on the front page. You look at the information about the textbook, which I'm going to talk about here more in just a second. You look at the class calendar and you kind of get a feel for what we're going to be talking about. I'm going to talk some more about that here in a second. You look at the due dates, you look at some of the guidelines, all of that you know how to do with a college syllabus. And so it's just going to be really important for you, as always, to make sure you get a copy of the syllabus to get kind of a feel for and take a look at what we're going to be doing in this class this semester. So here's what you're going to see when you look at the syllabus. So number one, this class is called Abnormal Behavior. And one of the things we do in many of our classes, as you know, in the social services program, human services program, is in certain classes, we identify and talk about certain populations of clients. So in the social services field, there's a range of different types of people that we work with: children, adults, the elderly. We work with people in counseling, social work, advocacy, case management. We work with people who are homeless. We work with couples. We work with people experiencing who are involved in the legal system. We work with kids and substance abuse. We work with all kinds of different types of clients or client populations. Probably one of the biggest populations that we serve in social services, it's really what drew me to social services, is the issue of mental health. For whatever reason, many of you may be like this, from the time I was a high school student and a college student, I always had an interest in working with people with mental health problems. And I've been very fortunate in my life. That's been the bulk of what I've done in my career. I worked as a mental health counselor and a mental health program director for many, many years. It's a huge part, as you know, of what we do in our field, providing support, education, assistance, help, counseling, social work to people who are experiencing what we would just refer to as mental health struggles. It's a huge issue in our culture and our society today, and it's something that is central to what we do in social services. So that's what this class is about. This class is really about people. And so sometimes in a class like this, that might be hard to kind of see, because we're going to talk about disorders and diagnoses and symptoms and that kind of thing. We're going to talk more about that in our opening module. But the class is really about people, as all of our human services classes are. They're about people. And they're about working with people who have specific types of needs and struggles. It could be anxiety, it could be depression, it could be eating disorders, it could be something like schizophrenia, it could be post-traumatic stress, whatever it may be. Mental health, we'll talk more about this here in the first module. Mental health can look a number of different ways as far as how it affects us. We all have something called mental health. And sometimes we struggle in that part of our lives, our mental, emotional, behavioral part of us, our mental health. And so that's what this class really is about. And we have a guide in this class, and it's our textbook. Now, some of you may have already heard of the textbook in our class. I know before I took my first abnormal behavior class back as a college student, I had heard the initials, the DSM. I sort of knew what it was. I wasn't fully aware completely. I realized later what it was, but I was familiar with the initials, the DSM, which stands for the Diagnostic and Statistical Manual. And that is the textbook that we use for our class. So here it is. Here is our textbook. And so many of you may have seen copies of this book. Maybe you have been to a physician's or a doctor's office, or maybe you've been to counseling, or maybe you saw a classmate who had the DSM. This is the 5th edition. This is the current edition that we use in the social services field. So we refer to it as the DSM-5. And so you've heard that term before. I had a student who took this class probably 2 semesters back, who in the first couple of days, it was a face-to-face class, she was talking about how she was completing her drug and alcohol field practicum, and how like on her 2nd or 3rd day there, she was in a training where the person doing the training, her supervisor, brought out a copy of the DSM-5. And she said, I kind of was proud that I could say, I know that book. I'm using that book right now in one of my classes at Lone Star College, Montgomery. It's our textbook. And she said that she had fellow practicum students from other colleges and universities who didn't even know yet what the DSM was. Well, she knew because she was in this class. So the DSM-5 is our guide. When I say our, I don't mean in our class necessarily. I mean our meaning in our field. In the field of social services, counseling, social work, and psychology, the DSM-5 is published by the American Psychiatric Association, and it serves as our guide when it comes to evaluating and assessing and planning treatment for people with any range of mental health struggles. It's a great resource to have. And so we're going to talk some more about the DSM-5 in our first module. A part of what I do at the start of this class is we talk about the textbook. And you'll see that in our first module, that part of what I want you to do in this class is to learn about what the DSM-5 is. I would encourage you, the DSM-5 is one of those books that if you're serious about working in the field of social services, it could be addictions counseling, it could be working with older people in hospice, it could be just general counseling or whatever, you're gonna need a copy of the DSM-5 anyways. I'd go ahead and buy it now. That's what I was told when I was a student, and it was exactly true. I was told as a student many years ago when I was getting my degree in counseling, I remember a professor saying, hey, if those of you in the room who are serious about this profession, you're never not going to have a copy, the most recent copy of the DSM. You're always going to have a copy on your bookshelf. When new editions come out every 10, 15 years, you're going to get another one. It just comes with the territory of working, especially in clinical social work and assessment and counseling in our field. So if you don't already have the book, I'd go ahead and get a copy of the book. You can also order an e-copy online, I believe. But it's one of those books you're always going to have on your bookshelf. I've never, and again, as my professor was right, since I entered the field, I've never not had a copy of the DSM. When I teach here, and when I was working in the field, it's just a handy, important resource that we use in all kinds of ways. I'm going to talk some more about the DSM-5 in our first module, but that's the information about the book that we use. We're going to use the DSM as our guide. When you look at the first and second page of our syllabus, and you look at the course calendar, you're going to see in the middle column these 8 different modules that we're going to work our way through. The very first module is open and available for you right now, and I just call it our foundation module. Module number 1 is open right now, and you'll see in that module, as is the case with the other 7 modules, there are some things in there. And again, many of you have been with me in my classes, my online classes before, so many of you are familiar already. How each module has a lecture video like this one. It has a PowerPoint presentation. It has some written lecture notes. It has some videos. It has some case studies. And it has a homework assignment. So the first module, module 1, is called Foundations. It's up and available for you right now. And you have some work to do. So as soon as you get done with this video and you look at the syllabus, you've got some work to do. And with every module in our class opens on Monday. This very first module, if you look at the course calendar, look at those dates carefully, you'll see that this first module called Foundations, module number 1, is available just for this first week. And you have until the end of this week on Sunday at 11:59 p.m. to do your first homework assignment, your module 1 homework assignment, right? Starting next week with module number 2, the modules are available every 2 weeks. And you'll have 2 weeks to work through because some of the modules have a lot of information in there. There's a couple of modules we're going to cover in the middle of the semester where you may need several days to kind of work your way through them, right? So for most of the modules 2 through 8, they open on Monday and they're available for 2 full weeks. You have 2 full weeks to go in and do a homework assignment and a quiz. With this first module, module number 1, Foundations, you'll see on the syllabus, all you have is a homework assignment. Starting next week with module number 2, modules 2 through 8, you have not only a written homework assignment due on a Sunday at 11:59, you have a quiz that you have to do as well too. So you have 2 things to do for a grade in most of the modules. And you'll see with module number 2, we're going to start with schizophrenia. Each of the modules is going to cover a different chapter out of the DSM. That's how the DSM-5 helps us to organize all of the range of different mental health conditions in our world that we see in our service areas. We work in social services. The DSM has them organized for us. It has a chapter on schizophrenia, the schizophrenia spectrum disorders. It has a chapter on the mood disorders like bipolar disorder and depression. It has a chapter on anxiety, a chapter on eating disorders, a chapter on substance use disorders. And that's one of the purposes of the DSM-5, which we'll talk about a little bit later in our first module, is that one of the purposes of the DSM is to help us to give some organization and some structure to the wide range of different ways in which mental health can affect people, right? So with each different module, we're going to do a different chapter. And you're going to work your way through. You're going to watch, I hope you'll watch all the little videos I posted for you. You're going to look at the PowerPoint presentations, I hope. You're going to read the lecture notes, do your homework, and do a quiz, right? And so that's kind of how the class is organized, is reviewing all the different ranges of different kind of mental health conditions that we need to be familiar with if we work in the social services field. Along the way too, you'll see also in the syllabus that there are 2 other written assignments due along the way. So here pretty quickly, I'll be posting for you what's called the website review assignment. That I'll talk more about that whenever I post that assignment. That assignment is a written assignment where I use that assignment to kind of raise your awareness of some of the online resources that are available, both professionals and clients, related to mental health. So there's a website review assignment. And then there's also a movie review. There's 5 different movies on the movie list. And you're going to pick one of those movies. And I'm going to have that posted a little bit later in the semester, where you're going to view a movie that portrays a primary character experiencing the symptoms of a mental health condition, something that we've talked about in class. I'm going to ask you to do a little assessment and diagnosis and synopsis of the movie and tell me what you see. And so that's coming later in the semester, a movie review assignment. So again, go to the syllabus, make sure that you look at the due dates for all of those assignments, the module homework assignments, the quizzes, the website review, and the movie review, all important. Let me kind of back up a second. Some of you are familiar already if you've had me before in any of my online classes. I mentioned there's quizzes. So there's going to be a quiz for modules 2 through 8. Starting with the next module, you're going to do a quiz. I want you to make a special note in the syllabus of the availability dates. And the quiz is always open at noon and they close at 11:59 or midnight on certain days. Make sure you get those days in your calendar. And here's why. For various reasons, I do not allow makeups of missed quizzes. If you miss a homework assignment, I give you a couple of extra days of grace. You should not need a couple extra days, but occasionally people need a couple extra days. That's fine. I don't do that with the quizzes. So if you want to avoid a 0 on any of the 7 quizzes, you have to take them while the quiz is available. Once the quiz closes at 11:59 or midnight on whatever date it closes on, it goes away. It doesn't ever come back. So you want to make sure that you're taking the quizzes while they're available, because you don't have any grace period there if you were to miss one, for example. So make sure you're aware of that, and that you're keeping up with all those dates. So one last thing, then I'm going to turn you loose and let you go to Module 1 Foundations. One of the things I sometimes say in this class, and I'm going to kind of end our conversation here today with this. Many of you in the class may have no interest as a professional in working with people with mental health struggles. Maybe you want to work with children, or you want to be an addictions counselor, or you want to work with the homeless, or whatever, elderly people, whatever you want to do. So I always tell people, when you work in a field like social services, you're always working with people with mental health struggles. That may not be your job title. That may not be your expertise or your focus. You're always going to be working with people with mental health struggles. It's sort of like substance abuse. Many of you in the room may say, I don't want to be an addictions counselor or an LCD. I don't want to work with people with substance abuse problems. If you work in social services, you're going to work with people with substance abuse problems, even if that's not your primary purpose. You may be a case manager at a women's shelter, for example. Well, that's not really mental health or substance abuse as far as what you're doing there. But guess what? Almost probably 80% or 70% of the clients you would have on your caseload are going to have either drug and alcohol and or mental health struggles. So that's part of why this class is important, and we require it of all of our students, is because you need to be familiar, if you're not already familiar, with how some of these mental health struggles look, to raise your awareness, to raise our awareness, so that we can be understanding and sympathetic and empathetic, and also be good in our clinical work when it comes to assessment and referral, all that kind of stuff, right? So much of what we talk about in this class, you may already know, you may already be familiar with, but my hunch is there's going to be some that we talk about in here this semester that may be new to you. And so I hope that's the case on both ends. So again, welcome to the class. Go find the syllabus, make sure you get the due dates. Go ahead and make arrangements to get your textbook. I give you some textbook information both in the classroom and on the first page of the syllabus. My contact information is on the first page of the syllabus as well too, as far as my phone number and my email, my Lone Star email address. You can email me also in the classroom as well too if you have any questions or problems. I'm glad you're in the class. Hope you're looking forward, like I am, to this semester in this class. And I will see you in module number 1.